Welcome to Anti-Aging Insights, where age is a state of mind and aging is a treatable condition. And now, here is your host, Dr. Teri Fisher.
Hello, and welcome to this week's episode of the podcast. As always, it's an absolute pleasure to have you along for this episode. If you have been listening to the last couple of episodes, you know that I am doing a journey from the top of the head, working our way down through the various muscles in the face that we can use neuromodulator on. Neuromodulator is often referred to by the brand names such as Botox, Nuceiva, Dysport, Xeomin. But in any case, we are on this journey. We have covered the frontalis, the forehead muscle. We have covered the procerus, the muscle between the eyebrows. We have covered the corrugators, which are the muscles that pull the eyebrows together. And we've covered the orbicularis oculi muscles, the muscles that are around the eye. And today we are talking about a muscle that perhaps is a little bit lesser known as the nasalis muscle. And this is a muscle that is not always treated. It's not as commonly treated as some of those other muscles that I have mentioned, but nevertheless, it can have some really great effects. And today I want to chat with you a little bit about the nasalis muscle, what it is, what it does, and how treating it can help with some of the facial lines that you may have on your face. So let's talk about, first of all, the anatomy of the nasalis muscle. Where is it located? What does it do? Well, you may guess from the word nasalis, it is situated on the nose. The nasalis muscle runs across the nasal bridge and it extends down and attaches to some of the deeper bone on the cheek, and it helps to move the skin above the nose as well as flaring the nostrils. The lines that are caused by movement of the nasalis muscle are often referred to as bunny lines because when you scrunch up your nose, yes, that's the medical term, scrunch up your nose, you can create little lines along the sides of your nose that look like a bunny. And so they are often referred to as the bunny lines. Technically speaking, it is the lines that are formed by the contraction of the nasalis muscle. So if you were to go into a mirror and I said to you, scrunch up your nose like a bunny, and you can just imagine doing that type of movement, you may see some lines that are, for the most part, horizontal, but they can be at a little bit of an angle along either side of the nose, just near where the nasal bridge is. Sometimes when you have a big smile, these may come out, or sometimes when you do certain facial expressions without even thinking about it, these lines may be present. Now, some people don't mind these, of course. Some people don't want to have these lines. And in particular, if you have had other areas of neuromodulator treatment in your face and your face for the most part is very smooth, then when you make certain facial expressions, the bunny lines kind of stick out a little bit then because they're potentially an area that hasn't been treated. So when we put neuromodulator in the bunny areas, the bunny lines, the nasalis muscle, this is typically done with 1, 2, 3 injections depending on the strength of the bunny lines. The dosing is usually quite low for this area because it's a very small muscle. It takes just a couple of units. There's a little bit of a range, and depending on how the lines look and depending on the expertise of the injector, we can choose different dosing for you. But nevertheless, it is a small little injection, typically 1 injection on either side of the nose, sometimes right on the top of the nose, and as always, neuromodulator works by relaxing the muscle that it is being injected into. So when the nasalis muscle relaxes, it does not contract as much. You get less lines, less wrinkles as a result, and the nose can have a much more smooth appearance. And when you are making certain expressions, you don't get those lines that are forming along the side of the nose. It's a very simple treatment. It takes just a few seconds, literally, a couple of quick injections, and then you're off. As always with neuromodulator, it does take a couple of days for the neuromodulator effects to kick in, and it does take about a week to 10 days for the full effect of the neuromodulator to be apparent. It then lasts for approximately 3 months or so, depending on the person and your metabolism, but then of course that can be repeated at that time. So again, it's something that can be considered as an add-on to other more common types of neuromodulator treatments. Again, the most common ones would be the glabella region, which would include the procerus and the corrugators in the middle of the eyebrows, which cause the 11s, as well as the frontalis in the forehead for the horizontal forehead lines, as well as the orbicularis oculi muscles for around the eyes, which cause the crow's feet lines along the sides of the eyes. Nasalis, as I mentioned, can be another area that you can add to your treatment plan. So just ask your injector about that. If you are seeing me as your injector, then of course ask me about that. I may even bring it up if I happen to notice them. And we can have a discussion about whether or not treating the nasalis could be right for you. So that's it today, a relatively short episode for the small muscle nasalis. I hope that helps to understand a little bit more of an area that you can treat with neuromodulator. And as always, if you want to contact me and reach out, I'd be happy to discuss this with you. You can always reach me at antiagingvancouver.com by booking an appointment, or on my Instagram at Dr. Teri Fisher, or my website, drterifisher.com. Have a wonderful week, and we'll continue on with our journey through the face next week. And by the way, if you haven't listened to the previous episodes, then please go back and do that so you can learn about the other muscles that we can treat with the neuromodulator. And I'll finish off with one more thing. If you are enjoying the podcast episode and you haven't left a review, then please consider leaving a review. It means the world to me, and it does help the podcast to be found by other people as well that may benefit from listening to some of this information. And of course, sharing it is the highest compliment you can give. So I appreciate that if you do share out this podcast to other people that you think might be interested in it. Anyway, enough said about that. Enjoy your week, and I'll talk to you again soon. Take care.
Thanks for listening to today's episode of Anti-Aging Insights. Stay tuned to discover more of the latest news, treatments, technologies, and developments in non-surgical cosmetic and anti-aging medicine. For more inspiration, to access the show notes, or to book an appointment with Dr. Fisher, Dr. Frame, or any of the other anti-aging professionals, please visit our website at antiagingvancouver.com. Until next time, stay inspired and live life well.